hello, hi. Hi, okay, hi. It's Jessica, respiratory therapist, and today we're doing various scenarios. So I am to practice educating patients on medications they're receiving. I'll make a video of my instructions for two of the scenarios, one adult, one child. Then I'll give feedback on my class. Okay, great. Yeah, so I'm doing some education today. So let's start with patient number 1. He's Mr. Carney. He's a 70-year-old man. And he is prescribed Duo-Neb with 1 cc of 10% mucomist, QID and PRN, and Symbicort, 160/4.5 BID. So what this means is Mr. Carney will be using a nebulizer to take his medication with the Duo-Neb and the mucomist. Duo-Neb is albuterol and ipratropium bromide mixed together. And it goes in the nebulizer as a liquid medication, which is then nebulized and turned to an aerosol, which is then sucked down your throat into your lungs, and it deposits medication that way. So what Mr. Carney's doing is he's taking bronchodilators when he does this. The bronchodilating effect of the first one I said, albuterol, is it's a beta agonist and it's fast acting. So when your lungs get tight, the bronchial muscles surrounding the airways, they constrict, get really little, and it's really hard to breathe. But what this does is it relaxes the muscles, which opens up the airway. So when you take Duo-Neb, it opens up your airways and you're able to breathe easier. Albuterol is a short-acting one, so it kicks in real fast, 3 to 5 minutes. It doesn't last long, 4 to 6 hours is how long it lasts, so it's short-acting. It's mixed with the ipratropium, which is a different class of bronchodilator. It's an anticholinergic. What that does is it blocks acetylcholine, which is a neurotransmitter that can cause the effect of bronchoconstriction. This blocks it and opens it up. So it is a maintenance med. It's not a rescue one. It's long acting. It's not a slow one like the albuterol. It's a maintenance. So by blocking that action, it's preventing anything from making the constriction happen. So it's a maintenance. It's a preventer, so to speak. Mixed together into one convenient nebulized medication, which Mr. Carney will put into his nebulizer combined with the mucomist. The 1 cc mucomist is 1 milliliter mucomist. You can add it right into your nebulizer cup along with the Duo-Neb. Mucomist, it kind of what sounds. It's mucus. It's mucus. When mucus gets too viscous or thick, I guess so to speak, it becomes thick. It can't move. The ciliary transport is what they call it. But your lungs have a system of moving mucus out. Mucus is normal. It's a normal part of your lung function. It has an important actually function in your lungs. But when you're sick, something happens, irritation, inflammation, it can become thick and it can't get up. Your body can't move it up because it's not the correct thinness that your body needs for it. Mucomist breaks down some of the mucin in it. Mucin is an agent that holds mucus together, breaks it down and makes it less viscous. I'm not sure what the opposite word is. Less viscous. And then easier to cough up and expectorate. Mixed together in your nebulizer. QID means 4 times a day, okay, because 4 to 6 hours is about how long these last. And PRN means as needed. So if Mr. Carney were to have an episode of constriction where he can't breathe or feels he's getting tight, he can take more Duo-Neb and mucomist. Mix them together. Take them both, and it'll help relieve. So he's not going to have to wait until it's been 4 hours. If he's having a breathing problem, 2 hours in, he can take more medicine. So that's the Duo-Neb. Now the Symbicort he's taking, that actually is a steroid medication. It's a metered dose inhaler. The steroid medication is an anti-inflammatory. That's what steroids do. So what's causing the underlying issue, what's causing the underlying problem of the bronchoconstriction is inflammation. It's an immune response. When something gets in your airways and irritates it, your body responds with what's going on? What is this? Why is this happening? So it sends its immune response to see what's going on. And your body can have a hyper response in certain scenarios where it starts it starts attacking. It starts, releasing histamines and prolactins and eosinophils and neutrophils and white blood cells. They all rush in there, and it causes problems. And one of the effects that they have of inflammation is this bronchoconstriction, always the underlying problem. So Symbicort, there's Mr. Carney. Mr. Carney, please stop whining. I'm getting you all fixed up. Sorry, whining. Symbicort, it prevents the mediators of inflammation, meaning the things I just mentioned, all those big words, neutrophils, eosinophils, and prostaglandins, and cytokines, leukotrienes, all those things. Those are all things that make your, it prevents those from happening. It actually does it through your DNA. Not sure how that works. Kind of cool, though, but it stops them from happening. So that is a steroid medication, and that says BID, which means 2 times a day. And this is not a rescue inhaler. It's not a bronchodilator. This is not something you want to take if you're... Don't do it. This is a maintenance. This is a preventative in a way. So that's Symbicort. Now, it's a meter dose inhaler, and that is, push, shake, push button, actuate. Always with the steroids, you want to use the spacer, the reservoir, the something. It's a thing you stick on the end of your... My pad is way too big. End of your inhaler, you put it on the end, and you don't want to swallow steroids. Which, if you think about how far it has to travel from your mouth to the back of your throat, it's not very far. So if you suck, you're going to get medicine to the back of your throat, and you might swallow it. Steroids cause side effects. They do. They're not pleasant medications for your body. There's a whole host of things that happen in your body when you take steroid medications. Luckily, fortunately, your lungs don't cause the systemic side effects that normal, if you took IV steroids or oral or whatever, they don't cause that because all the depositions in your lungs, not your bloodstream. That's not where it ends up. But if it does hit the back of your throat, it's going to stick there, and you swallow it, and it will go into your, bloodstream eventually. The spacer thing you put there, when you suck, it slows it down, just enough for it to kind of bounce down the back of your throat. It doesn't stick, it's not super fast. So use the spacer, please. It's very important. Mouth rinse. Also, after you're done with the Symbicort, what you want to do, you want to rinse your mouth out for the same reason, because it will stick a little, and if you swallow it, it can. I mean, I'm not saying it will, but it can cause side effects. So just rinse it out, just, you're done. And that will prevent some of the side effects that may or may not happen that it's just saying it could. So that are the medications. The steroids, they improve your lung function. They're going to improve lung function. They do it better. Sorry, Gabby. They do it better than the bronchodilators by themselves. In fact, they have a synergistic effect where the bronchodilators and the steroids actually work together to make breathing easier for you long term. So that's the rundown of Mr. Carney, the 7-year-old male, and his medications. And I'm going to go let the dog out. And thank you. Have a nice day.